Hi everyone, welcome to Jarrett, Claire, and Yuri's exceptionality presentation on depression. What is depression? According to the Ministry of Education of Ontario, depression is the term used to describe a feeling of sadness, irritability, or loss of interest in activities that a person typically enjoys. When these symptoms are coupled with more deeply rooted long-term issues such as sustained conflict with peers, disengagement in activities, ongoing academic struggles, or difficulties at home, the need exists for supports or intervention. Research shows that the early onset of depression is associated with serious lifetime psychosocial impairment, educational difficulties, and risk of development of severe depression. When depression is recognized early, and when professionals provide treatment, young people can experience improved mood and function better in school and life. Thus, the stakes are high. School personnel play a pivotal role in identifying depression and intervening. Teachers, administrators, and other school staff must also be knowledgeable about depression because the disorder can seriously impair academic and interpersonal behavior at school.
As instructors and teachers, to create an IEP, we need to know the condition of the student. Since depression is not a condition recognized by the ministry as a condition for an IEP, we still need to know what it is. So what exactly is depression? Well, an article written by Jessica Truschell from psych.com says that depression is a common and serious mood disorder. The person will experience persistent feelings of sadness and hopelessness and lose interest in all activities that they once enjoyed. And besides having emotional problems, these persons with this condition can also present with physical symptoms such as chronic pain or digestive issues. And so for them to be diagnosed with depression, the symptoms must be there for at least 2 weeks. In 2013, the American Psychiatric Association published Diagnostic and Statistical Manual of Mental Disorder, 5th edition, or short form, DSM-5, in which they published several symptoms, 5 of which are needed in the same 2-week period to be experienced by an individual to be clinically depressed. And as you can see here in this slide, in these 2-week periods, the individual must experience either depressed mood most of the day, nearly every day, markedly diminished interest or pleasure in all or most all activities most of the day, nearly every day, significant weight loss when not dieting, or weight gain or decrease or increase in appetite nearly every day, a slowing down of thought and a reduction of physical movement, fatigue or loss of energy nearly every day, feelings of worthlessness or excessive or inappropriate guilt nearly every day, diminished ability to think or concentrate or indecisiveness nearly every day, recurrent thoughts of death, recurrent suicidal ideations without a specific plan or a suicide attempt or a specific plan for committing suicide. So any 5 of these in combination over a 2-week period would indicate a DSM-5 diagnostic for depression, according to the American Psychiatric Association. Depression also has associated features, one of which, unfortunately, is the fact that it's associated with high mortality, much of which is accounted for by suicide. Unfortunately, many depressed persons will consider suicide, and some will even take it to the extent where they will go through with that suicide attempt, and unfortunately some are successful. The other associated features are irritability, brooding, obsessive rumination, report of anxiety, phobias, excessive worry over physical health, and complaints of pain. So these are all symptoms of depression. As instructors and teachers, we need to be on the lookout for symptoms in our students. Some of these being anger, changes in eating or sleeping habits. If we notice our students are very tired, are not eating, which may be a common thing that they do during our classes. Hopelessness, feeling of guilt, poor school performance. If we have a student that is usually a good performer in our class, if that's going downhill and it's consistent, then we need to be on the lookout. Lack of motivation, difficulty concentrating, tearfulness, frequent crying, restlessness, agitation, unexplained aches or pains, and thoughts of death or suicide. This last one they may not speak to us directly about, but if we overhear things, we need to take these issues and symptoms seriously and speak with someone appropriate about it.
Etiology. The course of depression is individualized. Some may experience a single, major depressive episode in their lifetime, whereas many others will experience recurrent episodes and significant vulnerability. In an epidemiological study by Eaton et al. On initial episodes of depression, more than 50% of people had a reoccurrence over the course of the research. There is also evidence that the risk for reoccurrence increases with each episode of major depression. Impairment in school, work, social, and family roles is often evident even when the individual does not meet the full criteria for a major depressive episode. Therefore, depression is likely to be disruptive of all lives and families. Genetic and biological factors play a role in the development of major depression, and many times these factors are associated with stressors and processing of emotional information. Etological processes are often dependent on gender and developmental factors. Environmental stressors also linked to depression include acute life events, chronic stress, and childhood exposures. Depression rarely occurs independent of other psychological disorders, including anxiety, substance use, behavioral, and personality disorders, as well as other medical illnesses. The presence of depression with the co-occurring disorders intensifies both the clinical and social implications of depression, making it more challenging and complex to treat.
So what would be the prevalence of depression in young adults, adolescents in Ontario? Well, according to the Children's Mental Health Ontario organization, these numbers are interesting. Half of Ontario parents report having had concern about their child's level of anxiety. 1/3 of Ontario parents have had a child miss school day to anxiety. 1/4 of Ontario parents have missed work to care for a child with anxiety. 62% of Ontario youths report having had concerns with their level of anxiety. And unfortunately, only 3 in 10 have spoken to a mental health care professional about this anxiety. And another unfortunate fact is many of 1 in 5 children and youth in Ontario will experience some form of mental health problems. 5 out of 6 will not receive the treatment they need. And 70% of these mental health issues that are becoming more apparent will have their onset in childhood or adolescence. And so 17% of children aged 2 to 5 meet diagnostics criteria for mental health problems, and 28% of students report not knowing where to turn when they wanted to talk to someone about mental health. Canada's youth suicide rate is the 3rd highest in the industrialized world, which is a very unfortunate fact. And so here, as teachers and instructors in the tech programs in Southern Ontario, Northern Ontario, we have a responsibility to be on the lookout for the symptoms and our students that have these issues going on in their life.
Prognosis. With depression, we cannot assume that symptoms are just a phase. There is a known association between depressed mood, personal life, and academic difficulties, and impairments in development, and more importantly, an association between depression and risk for suicide. Inadequate treatments are often available to individuals with depression, resulting in poor prognosis. To optimize outcome, each depressive episode should be treated as early as possible and with urgency, with complete resolution of symptoms as the goal, and maintenance of treatment. The longer depression is left untreated, the poorer the prognosis. Many patients who would benefit from maintenance therapy often don't get the help they need. Many holistic approaches are also often underused, such as the use of psychological approaches, education, herbal remedies, meditation, and the use of community supports, adding to poor prognosis. According to Halverson, approximately 80% of the individuals with depression can achieve a significant reduction in symptoms with proper action, although as many as 50% of persons with depression may not respond to initial treatments, and 20% have a chronic, life-lasting case.
So as instructors and teachers, how do we deal with students dealing with depression? Well, according to Supporting Minds, the document published by the Ministry of Education in 2013, we have several ways of accommodating or having strategies to deal with depression. And these will be creating an inviting classroom, teaching organizational strategies, instructional strategies, building a support network, teaching goal setting, counseling related strategies, working with parents, and understanding medical and clinical treatments. And we'll take a look at these individually. So creating an inviting classroom. By creating an environment that's inviting to the student with depression, it allows them to feel safe and to take healthier risks. Because a student that has depression avoids school if they feel threatened or insecure while in school. So it's important for us as teachers to believe that we can make a difference in the lives of our students and that all students can learn in our classroom, even those that are depressed. So the tone in the classroom emotionally is very powerful, especially for children dealing with depression. And so we can look at the following pointers that will help us to create that environment that will be conducive to learning for a student with depression. We want to be able to demonstrate an unconditional acceptance of the students, but importantly, that's acceptance of them, not necessarily their behavior, whether it be bad or misrepresenting what they should be behaving like. And this is vital for a student with depression. Be a good listener. If you aren't listening to the student, you won't be able to assist in ways that maybe they are asking for help in a roundabout way. It would be excellent to avoid singling out the student with depression. They already are in a state of mind that's fragile. They don't need to be put on a pedestal or made the center of attention. Humor is good in the classroom. It keeps the mood light, but avoid sarcasm, especially hurtful talk when it's dealing with students with depression. Always be positive about their improvements. Be very constructive when it comes to their improvements, specific and brief. Avoid using words like always and never. And be very specific about providing feedback, and also something that's appreciated by students, by most students, let alone students with depression, is routine, or as some call it, rituals that are conducive to learning. Teaching organizational strategies. Students that have depression will most likely need help in keeping their materials or assignments organized because they're not in a state of mind to do so on their own. And if we can give them a little bit of instruction and guidance in this regards, it's very helpful. So as we see here, there's 3 points. One of them is to provide an agenda or a day timer for assignments and tests, sort of like a syllabus. And we can get them to be organized. It makes mention of keeping binders, knapsacks, lockers organized and making it fun. Another thing that we can do is using positive self-talk. And this is good for all students, for that matter. We want to be there to show the students that it's okay to make mistakes. We can learn from our mistakes. It's not a job where if you make a mistake, you're going to get fired. We can provide them with the materials to make mistakes, learn from their mistakes, and improve. If they're going to show improvement, excellent, but we may have to adjust our learning and instructions very slightly if they are not improving. We also may need to help them organize their assignments, and if we're going to give them a complex project to do, break it down so that they understand each step of the way, their timelines, what they have to do, when they have to do it, how they have to do it, will be helpful for them. Instructional strategies. Here's several that will be beneficial for that. As was mentioned earlier, we want to listen. We want to have an interested tone, but don't press the student for information. Find out what they enjoy, what makes them happy, and you just have to listen to the student and talk and ask questions. What did you do on the weekend? What do you do for fun? What do you do to relax? And then keep that in the back of your mind and use it to your advantage. Of course, we want to be aware of their needs, special needs, or any learning problems that they may have. And of course, this next point goes back to listening. We want to have a conversation with our students. We want to listen to them. We want to see what their reactions are. We get a sense of who they are, how they react, then we can help them. We want to be very organized with a student with depression, give them detailed instructions. They can write it down, or you can hand it to them as instructions to how they do it. That way it eases their stress level. We can, if they're going to be having an exam, we can take the student out of a noisy environment and they can work on their own in a quiet space. Give them more time to perform the tasks required in the exam, more time to complete the exam. Give them time to think about it without any distractions or stress around them. We have to keep on top of them to make sure that the assignments are done without pushing. And we can use a variety of assessment methods so that we can see if their knowledge is growing. Building a support network. So students with depression need to be encouraged to build a network of support with parents, teachers, friends, and that with that support network, they're able to let people know how they're doing. And so being at school, if we're an approachable teacher, then students can come to us if they have issues, or know that our classroom is a safe space to come at break time or lunchtime. And we can be an advocate to assist them in communicating with other teachers in their time of need. We have to remember, though, we are not, well, most of us aren't trained professionals in dealing with depressions, but we can find the appropriate avenues to deal with these students' needs. We can encourage our students to maintain contact with the friends that they do have. Maybe they're in our class, they have a friend that they're close to. We can seat them together. They can help each other out and use themselves as a support system. We want to encourage them to communicate in a positive sense, not fighting or shouting or running away from a situation, but dealing with it. And if they're being harassed, to deal with the situation at hand in a positive way. We can encourage them to always be with a friend or a buddy at break. And as I mentioned earlier, if they want to come to our classroom, if they feel that's a safe environment for them, then always leave our door open. Teaching goal settings. For students with severe depression, very little is motivating to them. It's difficult for them to keep up with the rest of the class. And if they're seeking medical advice or counseling, until this treatment takes effect, it's important to show that you accept and focus on the students' accomplishments that they are able to do. They need to set goals, and you can assist them with that. And so for a depressed person, a goal should be short-term, not long-term. If they can accomplish one task today and then give them a task the next day, it's manageable. And so if they are helped getting these short-term goals set and then help to achieve these, it will build on their confidence and it will help with their depression. And then even if they don't accomplish it, positive reinforcement will help them to feel like their self-worth is alive and well. As teachers, we can help the mental health professionals dealing with these students that have depression. We can coach our students to be positive, especially when talking about themselves. We can encourage our students to get enough sleep. And if we notice that our student is very sleepy in class, we can deal with it on an individual basis, but maybe we can help them to realize that that's not very good to stay up late, but we can give them an easier task to perform that day. We can remind them that eating healthy is also helpful, as depressed persons tend to eat junk food, and it's not conducive to improving their mental state. Also, try to encourage them to stay physically active so that their sleep-wake cycle is not affected but improved, and activity will definitely improve their mental state. Working with parents. So just like an IEP, because depression is not part of the IEP development, we still would like to treat the student like a student that needs an IEP, and according to the discretion of the school board, the principal, and teachers of the student's school, we could create an IEP for them. So a teacher or counselor would be identified to be their advocate, assistant to help solving problems and communicate with the parents on an as needed basis. So that communication needs to stay open so that the parents know what is happening with their child and if their child is experiencing emotional difficulties. And the teacher or the advocate may notice that there are effects from medication being prescribed to the student that the parents and ultimately the student's medical health professional needs to be aware of, so that they may provide modifications to the medication. So just like an IEP, a team of school staff, parents, mental health professionals will be there to help the student. And we want to keep encouraging the parents of the child to keep actively involved with their child and their school. And as teachers, we want to keep that communication open. And then as teachers, typically we will have access to information in the school that the parents may not be able to. So if we can find the support group that would be of use to the student with depression, we could let the parents know, or the student, and that way they can access a support system outside of school. Understanding medical and clinical treatments. So once a diagnosis is made by a mental health professional and a treatment is implemented, we as the teachers most likely would be informed, and we need to educate ourselves so that we can deal with the student with depression and inform the parents of any sort of changes to the student's behavior, and also be able to adjust our own attitudes, our own behaviors towards the student while keeping their needs in mind. We need to be continuously supportive of the student as well as the parent during these times of need.
Our group presentation is on depression and how it affects individuals' minds, bodies, and how it plays a large impact on their attitudes and actions within a school environment or classroom. I'm going to talk about a few areas that we studied about this disease, and a little bit about how myself, my group members, and other individuals relate and feel towards this disease. So, etiology. The etiology is how the disease can be caused, or the science behind these causes. From my research and experience with depression illness, it's a disease that is caused from past and present experiences which occur in our personal lives. It is commonly seen as a mental health disease and is generally not identified by most schools or school boards for a reason to create an IEP. I'll get back to that on a separate note, but I just want to talk a little bit about the prevalence. So the prevalence of this disease is seen as a body-caused disease. It generally affects the individual during high-stress interactions and causes anxiety. By body-caused disease, I mean it is created from their own minds and reflections on certain situations. So that is why it is not usually identified as a disease and more a mental health issue. On the IEP note, I believe that as educators and mentors, a conflict like this does not always need to be identified and have such great action taken in order to find solutions, but it more or less comes down to being a good teacher, being a good mentor, and relating to these students and adjusting your ways and teaching methods to their needs and actions. From my research, there's definitely other ways to support the student during school time, such as therapy dogs, positive reinforcement, and just creating a supporting, welcoming, and positive class environment that they're in. Although an IEP can be needed, a lot of the time for a situation like this, that involves a much larger process as to what I just explained. It involves like getting guidance involved and getting your special needs coordinator involved and all those kind of things, which we have discussed in this class. But sometimes from what I've researched is it's not identified, so therefore they do not create an IEP because it's more a mental illness rather than a disease. I did a short little interview with a friend of mine just to see their thoughts and reflection onto a couple questions I asked them about this mental health issue. And so I just wanted to share it with all of you so that we can all see how a person who has little or no experience, both in a school environment and dealing with people who have this disease, has to say about it. Thank you.
What do you know about depression?
I know that depression is a mental illness. I know that it can affect anybody of any age, of any background, or of any culture, and that there is treatment for it. It can be either therapy or medication or a mixture of the two, and it can be different for everybody.
What do you recognize as a significant difference in this photo?
I noticed that there is a lot less yellow in the depressed brain compared to the not depressed brain. I wonder if this is related to the person's ability to think properly. It depends what the lighting represents.